Alright, so now we're going to talk about obsessive-compulsive disorder, otherwise known as OCD, which I'm sure that all of you have heard of because it's one of the most commonly stigmatized abnormal psych disorders. And as you can see on our title page here, I decided to throw off people who feel like they're slightly OCD by putting our names slightly to the left and not centered anyways. So, about OCD. The definition would be it's an anxiety disorder characterized by unwanted and repetitive thoughts or obsessions or actions, which are compulsions. So it's basically this kind of thing that would haunt a person, like if it's basically you can't stop thinking about it, it never leaves your mind. It's like a dark cloud that is over you. So you can copy that definition down or pause it, that works too. So, and then some signs of OCD. So people with OCD get really, really obsessed over senseless or offensive thoughts that just won't go away. So like I said, it's like a dark cloud that's always over them, and like everyone else would think that they're just overreacting and that it's not a big deal, but to them it means everything. And because of these obsessions, they will often lead to compulsive behaviors, such as rigidly checking or ordering and cleaning your house before guests get there because the thought of the guests judging your house on being dirty just won't leave your mind, and that's constantly on your mind. It's a common thing that OCD people would do. Or such as like washing your hands every 2 seconds because you can't stop thinking about all the germs, or like everything you touch has germs. Like a normal person wouldn't get that obsessed over it. And anyways, so some examples of OCD include a billionaire named Howard Hughes, and he, under stress, developed a phobia of germs, which, like I was saying, he just became really reclusive and insisted that all of his assistants that worked for him carried out elaborate hand-washing rituals and wore white gloves whenever they handled any sort of document that he would later have to touch, because he was that afraid of germs. And he ordered like there to be tape on the doors and windows, and he forbade his staff to touch or even look at him. And he claimed that his reasoning was that everyone carries germs around with them, and he wants to live longer than his parents, so he just decides to avoid germs at all cost. Another thing people will do would just like carry around a paper towel with them at all costs, or like wash their hands to the point where they're like raw and the skin isn't there. So that's extreme germophobia. And like people like this are so caught up in their obsessions that they're physically unable to function when things don't go as they're thinking that it should. So how to determine someone has OCD, it's similar to the first PowerPoint slide we took notes on. There's a fine line between normality and a disorder, such as like everyone washes their hands, but someone with OCD will wash their hands like every couple minutes to the point where it's like not even healthy anymore, or like how everyone likes to check that their door is locked, but checking it 10 times to make sure it's locked isn't normal, and these are all signs of OCD. And like their obsession will noticeably take over their life, and it interferes with their everyday living. And I think that's the last slide, so anyways, thank you, peace.